Good morning to one and all. I am Ramani, Professor, Department of Fundamentals of Nursing, working in Sri Balaji Nursing College and Hospital. Course name Nursing Foundation. Course code 603. Topic Heart Application. Today we discuss about heart application. Definition. First, we see about the definition. Heart application is application of a hot agent warmer than skin either in a moist or dry from on the surface of the body. That is called as a definition. Hot application is application of a hot agent warmer than skin either in a moist or dry from on the surface of the body. That is called as a definition. That means the hot application means the sum of the hot is applied over the moist or dry skin area. That is called as a hot application. Second one, classification of the hot application. One thing, this is divided into two categories, one for local and general. In this local, it is divided into dry heat and moist heat. In this dry heat comes under the hot water bottle, chemical heating bottle, infrared lamp rays, ultraviolet rays, shortwave, diathermy, heating lamps, electric cradles, electric heating pads. These are all the things comes under the dry heat. Hot water bottle. In this hot water bottle, to fill the hot water into the bottle. Then they apply over the dry or moist area over the skin or the body part. That is now hot water bottle. Chemical heating bottle. Some of the chemicals are adding to the water. Then that chemicals solutions are filled into the bottles, that is cracked tightly, then applied over the moist and dry area of the skin or any other body parts. That is called as chemical heating bottles. Second thing is infrared rays. The light rays is applied over the wounded surface, that is called as an infrared rays. Another one is ultraviolet rays. Ultraviolet rays also same as infrared rays. Another one is short waves. That also same thing for that waves are applying or over the skin dry or moist area. And the next thing is diathermy and heating lamps. This is also some of the heats applied over the wounded surface. Through this way, the wound is healed very fastly and quickly without the any medicine like that. Then another one is electric cradles and the electric cradles or electric heating pads. The electric current is passed through the pads or the cradles. That cradles or the pad is applied over the dry or moist area over the skin, that is called as an electric cradle or electric heating pads. Through this way, the moist wounded surface, what will happen easily that the wound is healing processes take place. So easily that healing processes take place, immediately what will happen, the wound the size also decrease, the reduce the level, easily the patient is recover from the disease, that is called as an electric cradle and electric heating pads. So in this dry heat section, using the hot bottles and rays, waves, diathermy and heating lamps and cradles, electrical cradles, pads are used used to treat the wounds as well as the moist and dry area of the skin, or in particular or any other parts of the body. In this dry heat used for the water and chemicals, rays, lamps, cradles, pads. This types six types are used to treat the patients. That is called as a dry heat. Another one for the in the local moist heat. In the moist heat, one for the warm soak. It is otherwise called as local baths. Another one is now hot fermentations, that is compresses. Another one is uh, catabalsam. Another one is medical fermentation. Another one is paraffin baths, cis bath, aquathermia pad. It is these are all the moist heat. Next thing is dry heat. In this general, divided into two things, one for dry heat and moist heat. That is one in this dry heat, sun bath, electrical cradles, and blanket bed. Through this way, the hot fermentation is applied over the skins so easily. The wound is healed very quickly. The patient is recovered from the disease. That is dry heat. Another one is moist heat. One for steam bath, hot packs, whirlpool bath. It is a full immersion of the skin or particular affected part. So immediately what will happen? The wound is the easily healing processes take place. So dry over the area, the infection is reduced to recover from the disease. That is a moist heat. So classification of hot application, one for local, general. In this local, dry heat and moist heat. In this dry heat, hot water bottles, chemical heating bottles, infrared rays, ultraviolet rays, shortwave diathermy, heating lamps, electrical cradles, electric heating pads. This also comes under the dry heat. Moist heat, warm soak, hot fermentations, voltage cat balsam, tubes or medical fermentations, paraffin baths, cis bath, aquathermia pads. These are all the things comes under the moist heat. Another one is general. This is divided into two categories, one for dry heat and moist heat. In this dry heat comes under the sun bath, electric cradles, blanket bed. This also comes under the dry heat. Moist heat. In this moist heat comes under the steam bath, hot packs, whirlpool bath, full immersion bath. These are all the things comes under the moist heat. Next, we go for the classification of temperatures for treatment purposes are classified follows. What is the temperature? One by one, we discuss. Very cold, 32 to 55 degree Fahrenheit. Cold, 55 degree to 65 degree Fahrenheit. Very cool, 65 to 80 degree Fahrenheit. Neutral, 80 to 92 degree Fahrenheit. Warm, 92 to 98 degree Fahrenheit. Hot, 98 to 104 degree Fahrenheit. Very hot, 104 degree Fahrenheit and more. This is the classification of temperature for treatment purpose only. This is used by the nurses. Next, we move for the body's physiologic response to hot application. First one, peripheral vasodilation. Another one is increased capillary permeability. Another one is increased oxygen consumption. Fourth one, increased local metabolism. Another one is increased blood viscosity. Another one is increased muscle tone. Another one is increased blood flow. Another one is increased lymph flow. Another one is increased mobility of leukocyte. So, if you are administering or applying the hot application, what will happen? The blood vessels are dilated. So, increase what will happen? Increased the capillary permeability as well as the O2 level is increased, as well as the metabolism and blood circulation level is increased. Immediately, muscle tone level is contractions take place and increase the blood flow, lymph flow, and increase the mobility of leukocyte. This is the body's physiologic response to hot application. So everyone nurses are concentrated for physiological functions during the hot application. Next we discuss about systemic effect of heat. When the heat applied to large body area, the excessive peripheral vasodilatation is take place. So immediately drop in the blood pressure. So fainting is sometimes a place, that is not fainting attack. When you are applying the hot application over the particular area, so vasodilatation is excess in the peripheral vasodilatation. So immediately decrease the blood pressures. So fainting is take place. That is in a systemic effect of heat. This is for the nurses during application. The nurse should concentrate for the these are all the systemic effect is here. Effect of heat is should concentrated. Rebound the phenomena. One for each occurs at the time that maximum therapeutic effect of hot or cold application is achieved. Another one, heat produces maximum vasodilatation in 20 to 30 minutes. Another one is continuation beyond 30 to 45 minutes causes tissue congestion, the blood vessels constrict. Now, the opposite effect is occurring because of reflux vascular constriction. Recovery time of 1 hour is advised before reapplication. Once again, repeat. It occurs at the time the maximum therapeutic effect of hot or cold application is achieved. Another one, vasodilatation is maximum is produced 20 to 30 minutes. Then another one is the tissue congestion and blood vessel constricts nearly continuations beyond the 30 to 40 minutes, 45 minutes. Tissue congestion and blood vessels constriction is take place. Another one is reflux the vascular constriction. Another one is recovery time of 1 hour is advised before reapplication. Factors affecting heat and cold tolerance. First one, body part. Certain areas of the skin have a sensitivity to temperature variations. The inner aspect of the wrist and forearm, the neck and the perineal area are temperature sensitivity, while the back of the hand and the root are not as insensitive. That is the body part. The body part also affecting the heat and cold tolerance. Another one is duration of application. The therapeutic benefits of heat and cold applications are achieved with short periods of exposure to temperature variation, that is duration of application. Area of body exposed. The larger the area exposed to heat and cold, the lower the tolerance to temperature changes. That is the area of body exposed. Damage to body surface area. Increased skin areas are more sensitive than intact areas to temperature variations. That is called damage to body surface area. First one, body part is also one of the affecting factor of heat and cold. Another one is how many hours, how many times you are applying the hot application or cold application. That is, the temperatures also vary. So that is also affecting the heat and cold tolerance. Another one is area of body exposed. Depends upon the how long the body is exposed to the heat and cold. That also affecting the heat and cold tolerance, and damage to the body surface area. These are all the things factors affecting heat and cold tolerance. Another one is factors affecting heat and cold tolerance. One thing, individual tolerance. Tolerance to temperature variations is affected by age and physical condition. The young and the aged are especially susceptible to heat and cold. Neurosensory impairments may interfere with the reception and perception of stimuli, increasing the risk of injury. That is called as an individual tolerance. Individual is maybe the very aged person, so they impaired the tolerance level. So what will happen? Sometimes risk for injury. So this is the important factor is affecting the heat and cold tolerance. Another one is age. Thinner skin layers in children and elderly people increase the risk for burns from the heat and cold application. So this is also age group also affecting the heat and cold tolerance. Next, scientific principles involved in the hot and cold application. Water is a good conductor of heat. That is one thing. Another one, the flow of heat is from the hotter or to the less hot area. Another one, prolonged exposure to moisture increases the skin's susceptibility to maceration and skin breakdown, reducing the protection of the intact skin. And this is now third point. Fourth point, presence of steam increases the temperature of the hot application. This is now fourth point. Fifth point, woolen absorb moisture slowly but hold moisture longer and cool off less quickly than the cotton materials. This is the fifth one. Fifth one principle. Sixth principle, the temperature tolerance varies with individuals and according to the site and area covered. First and last, the friction produce heat. Once again, repeat the principles. Water is a good conductor of heat. The flow of heat from the hotter or to the less hot area. Prolonged exposure to moisture increases the skin susceptibility to maceration and skin breakdown, reducing the protection of the intact skin. Presence of steam increases the temperature of the hot application. Woolen absorb moisture slowly but hold the moisture longer and cool off less quickly than the cotton materials. The temperature tolerance varies with individuals and according to the site and area covered. First and last, friction produce heat. These are all the scientific principles of the heat and cold application. Next, we move for the indications of hot application. First one, decreases the level of pain. When you are applying the hot application, what will happen? Pain level is reduced. Another one is decreases the muscle tone. And third one, to promote healing. Fourth one, promotes separations. Fifth one, to relieve deep congestion. Next one, softens the exudates. One, provide the warmth, then stimulates the peristalsis. Once again, repeat the indications. Decreases the pain level, decreases the muscle tone, promotes healing, promotes separations, relieves deep congestion, softens the exudates, provide warmth, stimulate peristalsis. Heart application contraindications. Contraindication malignancies, another one acutely inflamed areas. Fully malignancy, fully necrosed. Another one acutely inflamed area on clients with paralysis. When the patient, sometimes, what is the contraindication means the hot application is not applicable for some of the patients. For what type of patient is not applicable? One for malignancy, any cancer, or acutely inflamed area on clients with paralysis, those who are suffering from paralysis patient, and open wound and edema associated with venous or lymphatic diseases, clients with metabolic disorders, very young and very old clients. First one contraindication is malignancy, acutely inflamed areas on clients with paralysis, open wounds, edema associated with venous or lymphatic diseases, client with metabolic disorders, very young and very old clients. These are all the contraindications for hot application. Another one is complications. What are the complications after applying of hot application? One for pain. When you are applying for the long time, what will happen? In reducing our aim is to reduce the pain. But if you are applying for the long time, what will happen? Increase the pain level. Next one, burns. What will happen when you are applying the hot application more than the times, hours or minutes? What will happen? That the skin is burning us take place. So that is another one complication. Then maceration with the moist heat, that is maceration. Fourth one, redness of the skin. If you are applying the hot application over the skin area, what will happen? Redness is take place. How the redness is take place more than this particular time, 10 minutes or half an hour, what will happen? That long time as you are applying for the hot application, immediately redness is take place over the skin area. Next thing is edema. If you are the same thing, if you are applying this long time, edema, pallor, hyperthermia is take place. These are all the complications for the hot application. Once again, I repeat the contraindication. Malignancy, acutely inflamed area on clients with paralysis, open wounds, edema associated with venous or lymphatic diseases, client with metabolic disorders, very young and very old clients. These are all the contraindications for hot application. Then complications. One for pain, burns, macerations with moist heat, redness of the skin, edema, pallor, hyperthermia. These are all the complications of hot application. Next, we see about application of hot water bath. First one, see about the purposes. To stimulate circulation by dilating the blood vessels. That is the main aim. Another one is that is the main thing for the hot water bag. Another one is to relieve the pain and congestion. Already we discussed about the what is the purpose, what is the indications. This what are things we discussed in previously also. Just we discuss what is the main purpose. One for stimulate the circulation. Another one is to dilating the blood vessel by and relieve the pain and congestion by encouraging flow of blood and to supply the warmth and comfort, to promote healing, to relieve the retention of urine, to relieve the muscle spasm, to contract the sudden drop in temperature during the cold sponging, to raise body temperature in case of hypothermia. What is the exact purpose of hot application? One for stimulate the circulation, another one is to relieve the pain, another one is congestion, relieve the congestion, and fourth one is to apply the warmth over the area and to promote, then to provide the comfort to the patient, to promote healing. Another one is to relieve the retention of urine and to relieve the muscle spasm. And another one is raise the body temperature in case of hypothermia. So these are all the purposes for hot water bath. And what temperature you are maintaining during the hot application. And for normal adult and children, over the 2 years, 42 to 52 degrees Celsius in Fahrenheit, 115 to 125 degree Fahrenheit. Unconscious adult or child under the 2 years, 40.5 degrees Celsius to 46 degrees Celsius. That is exact the Fahrenheit, 105 degree to Fahrenheit to 115 degree Fahrenheit. This is the temperature of hot water baths. What all the articles we discuss. A tray containing hot water bag with cover 1. That means hot water bag. After that, filling of hot water to cover the bag with use of the cloths, cotton cloths you can use to cover the bag. Another one is a jug, one for hot water and another one for the cold water. Because we mix with the hot and cold depends upon the skin, over the skin you are applying over the skin. Sometimes this patient is not tolerated, sometimes it's not tolerated. So very high temperature what will happen, very difficult to tolerate. So that reason only we mix the hot and cold water. Then next thing is the duster, one to dry the outside of the bag, and towel, one to insulate or bottle from heat loss. And another one is Vaseline or oil, petroleum jelly to apply the skin in case of redness. These are all the articles for hot water bag. Once again repeat, hot water bag with cover, 1 jug to mix the hot and cold waters, duster, 1 to dry the outside of the area, towel, 2 maintain the heat loss, and Vaseline or jelly or like that oil and to apply over the skin area to prevent the redness of the skin. These are all the articles in the click tray. Next, we go for the pre-preparation of the patient. One thing, to identify the client, explain procedure to the patient, provide privacy to the patient, drop the part according to need and expose required part, and provide the comfortable position to the patient, wash the hands, arrange all the articles in the patient bedside. First, you can identify the client. For example, Murugan, so many Murugans, S Murugan, N Murugan, M Murugan, so many patients are there. Which patient, the doctors prescribed this patient, you can apply the hot application. Like that, they are mentioning in the case. Go and check to identify. This is the correct patient, N Murugan. This is the correct patients. The hot application prescribed to these patients. Okay, you can identify. Then go to the particular bed. You can go and ask the patient. You are the N Murugan. You are coming from this place. Okay, you are the okay. This patient is applicable for hot application. Confirmation. Explain procedure to the patient. Explain after that. You can explain. The doctors advised to give the hot application in 5 o'clock. So I come at 5 o'clock, give the hot application. You please be ready. Nothing has happened. No fear, please. You be happy. Just like a hot, like us na warm, look like us now warm feeling take place. That hot application. So nothing has happened, ma. Like that, you can explain each and everything. And that can provide the privacy and draw the part according to the need and expose required the part. Provide comfortable position to the patient. Wash the hands. Properly arrange all the articles in the patient bedside. Procedure: to mix the hot and cold water and check the temperature should be between 120 to 149 degree Fahrenheit. First, then pour hot water in the hot water bag, 2/3 or one or off of the bag or 1/2 of the bag to fill it with the use of the hot water, and place the bag in a flat surface and remove the air, cover it tightly. You can place the bag over the table and place it, and you can let out the air from the bottom to the top. Then gradually the air is let out, and you can cover the bag tightly with use of the cork. And then next, dry the outside of the bag with use of the duster. Then check the leakage of the bag by keeping it upside down. You can check any leakage in the bag or not, and wrap it with the towel and take it to bedside of the client. Wrap the hot water bag with use of the towel and to take it to bedside of the client. Next thing is to dry the body area to receive the heat if necessary. That means to apply the hot water bag over the particular area. Then assess the area. Keep the bag to in place of appropriate time 20 to 30 minutes. Cover the bag with towel. Assess the client and skin area. Apply the Vaseline. So far, that is procedure. Mix the hot and cold water 120 to 140 degree Fahrenheit and pour the water to 2/3 or off of the water bag, and you can place the bag in a flat surface, let out the hair and tie the hot water bag with use of the cork, and then check and then cover outside. You can dry it with the use of the dusters, and then you can check the leakage. The bag you should be keep it in upside downwards. Then you can wrap the towel and apply over the area. Then you can wait for 20 to 30 minutes. After that, you can remove and apply the Vaseline over the skin area. Then you can check whether there is any other redness like that is present or not, like that. That is in a procedure. After the care of the patient, leave the clients in comfortable position and cover the clients with the sheet and remove the drapes and replace all the articles. Wash the outside of the bag with the soap and water. After emptying the bag, keep upside downwards. After this drying, store it in proper place. Wash the hand and document the procedure. After care, the clients is provide comfortable position, remove all the sheets and replace all the articles. Wash all the articles and the bags with the use of the soap and water, and you can dry it in the sunlight. After emptying the bag, keep it upside downwards. You can hang it. After you can dry it once again, and then you can store it in a cupboard and wash the hand properly and document the procedure, date and time, name of the patient and diagnosis of the patient, each and everything. After that, you can inform to the doctors, I have finished for this work, like that. Okay. Any other complication of the patient, you can note it or record it, as well as the inform to the doctors, you apply over the skin area or apply for the Vaseline, like that. This is the after care.